Okay, I'm providing privacy and performing hand hygiene. Hello, my name is Alina. I'll be your nurse today. How are you doing? Patient states that they're doing fine. Today we're just going to do a quick assessment over your lungs. So I'll just be inspecting and auscultating. It should take about 3 to 5 minutes. Is that okay with you? Patient state that is fine. Okay, so when I inspect, I'm just looking over everything, making sure everything is fine in the chest area. And when I'm auscultating, I'm going to be using my stethoscope to listen. So it's just to make sure everything is intact with your lung sounds. So I just want to start off by asking if you have any pain or any allergies. Patients state they don't have any pains or any allergies. Okay, can you state your correct name and date of birth? Looking at the ID band, the patient says the correct name and date of birth. All right, so we're just going to start off by inspecting the accessory muscles. So we're just going to look at the anterior chest, and as I'm looking, my patient has the respiratory rate of 16 beats per minute, no nasal flaring. I'm looking at the anterior and the posterior compared to the transverse side, and it's 2 to 1, so no barrel chest at this time. The patient is in no respiratory distress. Okay, so now I'm just going to palpate. I don't feel any tenderness, any bruises. And I'm going to do the same thing to the back. No tenderness, no bruises, no lumps, no lesions. So everything is fine in that area. So now I'm going to touch the lower part of your back. And so we're going to perform tactile fremitus. And I'm just going to ask you to take one deep breath. And then I'm going to look for chest expansion. So as the patient takes a deep breath, the chest expands, and then my thumbs move away, and then they come back. Okay, so thank you for that. All right, and so now we're going to auscultate the anterior side. So I'm going to use my stethoscope. I'm going to make sure that it's on bare skin. Okay. All right, and so we're going to start off with the right upper lobe. So just take deep breaths with me. Right upper lobe, left upper lobe, right middle lobe, left upper lobe, left lower lobe, right lower lobe, and left lower lobe. Okay. All right, so the lung sounds is clear bilaterally when I auscultate, okay? And I'm just going to ask if you can turn around. I'm going to do the same thing to the back side. Okay? Again, this is on bare skin. So we're going to do the right upper lobe. Take deep breaths for me. Left upper lobe. Right middle lobe. Left lower lobe. Right lower lobe. Left lower lobe. Right lower lobe. And left lower lobe. Okay, you can turn back around for me. Okay, so how are you feeling? Patients state they're doing fine. Okay, any pains or anything like that? And patients state they don't have any pains. Okay, is there anything else I can get for you? Any water or anything? Patient states that they are fine. Okay, so at this moment, I'm going to lower the bed and bring up the bed rails. The call light is next to you. Whenever you need it, just press the light and then I'll come. So again, any pains, and patients say they're in no pain. All right, so I want to thank you for your time today and perform hand hygiene.